Hello everyone, we are from student group discussion B7 and we are about to present our student project with the topic subarachnoid hemorrhage. Before that, let me introduce myself. My name is Fiona Nathanael Santoso with my last three digit student number ID R249. And here's our outline of presentation. The chapter 1 is introduction, including background information, problem identification, objectives, and benefits. And chapter 2 is the content that including definition, epidemiology, etiology, pathophysiology, clinical manifestation, diagnosis, treatment and management, complications, and prognosis of subarachnoid hemorrhage. And the last one is the chapter 3 that including summary of our presentation.
So hi everyone, my name is Khadra Karin Kamila with the last three digits number 009. So here I would like to state about the background of the STREAM project. About 10 to 20% of stroke each year caused by hemorrhagic strokes. SAH is one of the most anticipated one because it can be the most life-threatening condition and is medical emergency. SAH accounts for about 2 to 7% of all stroke causes. The low frequency of occurrence inversely proportional to the very high morbidity and mortality of the case. Based on the urgency that has been stated, it is very important to understand about SAH as early as possible. And to the next slide, there are several problem formulations of this STREAM project, which are: what is the definition, epidemiology, etiology, complications, clinical manifestations, and pathophysiology of SAH, and how is the prognosis, treatment and management, and the diagnosis of SAH. And to the next slide, there are also some of the objectives of this STEAM project, which are to know the definition, epidemiology, etiology, complications, clinical manifestations, pathophysiology, diagnosis, treatment and management, also the prognosis of SAH. And next, the benefit of writing the student project is to enhance the knowledge and understanding of SAH. So that's all from me, and the next slide will be explained by my colleague. Thank you.
Hello, my name is Dhea Calista Ananda Putri with three last digit number 129, and I will present you about the definition of subarachnoid hemorrhage. Subarachnoid hemorrhage is defined as the accumulation of blood in the subarachnoid space due to medial aneurysmal rupture or traumatic head injury. Subarachnoid space is described as a space between the arachnoid membrane and the pia mater. It consists of the cerebrospinal fluid and the blood vessels that supply different areas of the brain.
Now we belong to the part two, which is the epidemiology. First of all, my name is Nathanael Dihardja with 3 digits of student number R26. Subarachnoid hemorrhage is a red bleeding brain emergency with global rates at 10 to 15 cases per 100 people thousand yearly and 10 to 15 in the USA. As matter in subarachnoid hemorrhage, older adults around age 55 face higher risk due to aging and weakening brain blood vessels, especially if they have a high blood pressure, making them prone to rupture aneurysm. Younger people also have a lower risk but may get more headaches afterwards. Genders also plays a role in subarachnoid hemorrhage. Women's risk is 45 to 50 higher than men's, mainly due to hormonal changes after menopause, which weaken the blood vessels. Certain types of aneurysms in women are also more likely to rupture, increasing their subarachnoid hemorrhage risk.
Okay, my name is Midakya Iwanagustia with the last digit number 105. So I would like to explain about the etiology. The etiology of subarachnoid hemorrhage can be non-traumatic or traumatic. Traumatic subarachnoid hemorrhage is mostly caused by head trauma, but is considered a spirit disorder. Meanwhile, about 85% out of non-traumatic subarachnoid hemorrhage are caused by aneurysm rupture into the subarachnoid space, the space between the pia mater that covers the brain and the dura mater that lines the skull. The other causes are arteriovenous malformations or AVM, psychotic aneurysms, and bleeding disorders. Okay, that's all from me. Next will be explained by my partner.
Good morning, my name is Gregorius from Thongiratama with three last digit of the number 35. Now I'm going to explain about the pathophysiology of subarachnoid hemorrhage. Subarachnoid hemorrhage or SAH could occur because of rising blood pressure or other things affecting hemodynamic stability. Therefore, an intracranial aneurysm could be developed and ruptured. Furthermore, there would be a compression on the adjacent brain matter, which could cause cerebral ischemia due to decreasing cerebral blood flow and potentially causes neurologic impairment. On the other hand, the bleeding from subarachnoid hemorrhage involving catecholamine surges could cause systemic consequences, including acute lung damage, neurogenic pulmonary edema, heart dysfunction, and systemic inflammatory syndrome. That's all from me, and thank you.
Hello everyone, my name is Fricillia Wijaya, but the last digit name is 36, and I will explain 2.5 clinical manifestations. The initial indication is in most cases is a sudden onset of a severe headache. However, individuals may also experience symptoms such as dizziness, vertigo, neck pain, nausea, and vomiting, which are common clinical manifestations. Patients may also mention a previous experience of a severe headache and/or a prior instance of minor bleeding accompanied by symptoms that resolved within the past month. This particular occurrence is referred to as a sentinel bleed, and it often precedes a more severe subarachnoid hemorrhage. It is all from me, and the next one will be explained by my friend. Thank you.
Hello doctors and friends, my name is Jovita Theodora Liu with last three digits 114. Now I'll explain to you about the diagnosis of subarachnoid hemorrhage. The diagnosis of subarachnoid hemorrhage or SAH can be considered in patients with a severe and sudden onset headache. Patients can experience rapidly increasing headache or thunderclap headache. The headache typically occurs within a few minutes and reaches its maximum intensity within 1 hour. Patient can also experience neck pain or neck stiffness, loss of consciousness, and limited neck flexion. The initial diagnostic measure for SAH is computed tomography of the head or CTH. A CTH will visualize blood easier at the onset of bleeding and becomes more difficult as the red blood cell degradation progresses. If the rate of negative CTH increases or non-contrast CTH is not definitive, physicians should perform a lumbar puncture up to 12 hours from symptom onset. ALP will reveal centophromia that indicates heme metabolism in the cerebrospinal fluid. That's all from me. Thank you.
Hello, my name is Fernando Ghosali and my last digit of student number is 036. Now I'll explain about the treatment and management. So the treatment and management of subarachnoid hemorrhage or SAH typically involve a combination of medical, surgical, and supportive measures. Here are the treatment and management of SAH. The first one is initial assessment and stabilization. The second one is imaging studies. The third is medical management. The fourth is surgical interventions. The fifth is monitoring and complication prevention. And the last one is rehabilitation and follow-up. That's all from me. Thank you.
My name is Tiffany Cecilia. Now I will explain about the complication of subarachnoid hemorrhage. So the early complication that can occur in subarachnoid hemorrhage is rebleeding. There are also several complications that can also occur in subarachnoid hemorrhage, such as vasospasm, increased intracranial pressure, hydrocephalus, seizure, brain herniation, and many more. Thank you.
Okay, so greetings doctors. My name is Abel Sianipar with three last digit of student number 118. So I'll be explaining to you guys about subarachnoid hemorrhage. So this disease is associated with high premature mortality. When a population-based study is published in 2017, found that approximately 18% of SAH patients died suddenly before even being evaluated in the hospital. Among patients who arrive at the hospital alive, the majority of early mortality is due to common complications of aneurysmal SAH, which is associated with initial bleeding, rebleeding, and vasospasm, and ischemia. Cerebral palsy, hydrocephalus increase the intracranial pressure, seizures, and cardiac complications. And long-term complications of SAH include neurocognitive dysfunction, epilepsy, and other focal neurological deficits. In one registry, more than 10% of patients with SAH
remain moderate or severely disabled. Okay, so that's all from me. Thank you.
Thank you so much for your time. My name is Deputada Praena with Udayana 28, so I will tell you about the conclusion and suggestion. So SAH is a severe medical condition involving bleeding around the brain, typically caused by intracranial aneurysm rupture. It affects both genders with age and hormonal changes and as contributing factors, characterized by sudden severe headache and neurological symptoms. Early diagnosis through imaging is crucial. SAH treatment includes stabilization, imaging, and medical intervention, surgery, and vigilant monitoring. To address AH's impact, public awareness campaigns should stress recognizing sudden, severe headaches and educate on risk factors like age and gender. Continued research into SAH causes and risk is essential, focusing on prevention strategies and improved diagnostics. Additionally, supporting research and development efforts for innovative SAH treatment can improve outcomes and lessen complications. Thank you so much.